Hearing health plays a vital role in our overall well-being, impacting everything from communication to cognitive function and quality of life. So here to tell us so much more about how Hearing and Tinnitus Center, Hope Hearing and Tinnitus Center can help is Dr. Beki Kellogg, and she is here to give us all of the details and some tips. How are you?
Good. How are you? Thank y'all so much for having me.
Oh, I'm so glad to have you this morning. I feel like I'm about to learn something even right now in this moment. Tell me a little bit, what is tinnitus?
So tinnitus, both pronunciations are correct, is the presence of sound when it's not there in your environment. It can be ringing, buzzing, chirping, cicadas. We've even had people say they hear music.
Really?
Yeah.
Okay. Because when you first started and you're saying the ringing, I'm thinking, okay, like when you're sick and you're congested and hear that kind of ringing, I'm assuming that's kind of what you're talking about, except without the sickness.
Correct. But that's actually how it can start. Like there's multiple causes, and a lot of times people can get sick, and that can be one of the causations of it too.
My goodness. Okay, so why do people think it's not treatable? Is it something that you can talk to people about, I'm assuming?
Yes. So, typically once like your sickness is gone, there's no wax in the ear. If it's not surgery or medication, it's typically thought there's nothing that you can do. Which really just is not the case with today's research, technology, and what we can do at Hope. We've got a great success rate.
My goodness. Okay, so when I'm hearing you say, like, people are hearing music, they're hearing ringing, they're hearing different types of sounds, first I'm astonished, but also, I mean, how does this impact people that you've seen, or what are people telling you?
So I feel like it's a slow, sometimes it comes on so suddenly with people, they're truly like anxious, depressed over it. And other times, like even an untreated hearing loss can cause tinnitus, and that can create other issues where they're not hearing their loved ones well. But a lot of times tinnitus also impacts people's sleep. And so when that's impacted, their whole next day is impacted, from their work to ability to focus and concentrate, and
it goes back to that quality of life we were talking about. It sounds like it dribbles into literally everything. My gosh. Okay, so I've heard, because we were talking about dementia earlier, and so tell me, because you're saying maybe there's even a link between hearing and dementia.
So Johns Hopkins did the study over 10 years ago that linked that, and it's been really validated by multiple studies since then.
Wow.
But as sad as that is, the other side of it is treating tinnitus and hearing loss is one of the most modifiable risk factors, meaning it's one of the best things that you can tangibly do to help prevent dementia.
Okay, so it is preventable. We just have to take the steps, and we need the knowledge to do so. Okay, so let me ask you this. How do we go into the treatment method? What are we looking at when it comes to tinnitus?
Yes.
I want to use both.
First step, calling our office is the first step, but what we do is everything's research-based, and it's a customized approach. It is a treatment plan, and it's not necessarily a quick fix, but it's a long-term fix.
Okay.
And it's something you can use and wear daily, and no one knows. You go about your day like normal. And actually, a lot of people that are anxious find that they, even after the 3-year treatment plan, will continue to wear it because they love it.
Wow.
So it's a great, very easy, and we'll show you in the office on your first visit what that feels like, sounds like, and looks like.
Okay, so you already know how to basically function with it when you leave the office.
Totally.
This is really good tips, and I had no idea there was a link between that, so we're all learning something this morning. Thank you so much for being here.
Oh, thank y'all for having me.
Of course. Okay, so if you're at home or maybe experiencing this, and you want to learn so much more, or even you're at your end point and you want to schedule an appointment, you can visit hopehearing.com, or you can call 817-591-7155. It's right there on your screen, or like I said, hopehearing.com.